Good morning, good afternoon, or good evening, depending on where you're joining us from. We are pleased to welcome you to today's ISSUP webinar. I'm Radolf Norte, a National Chapters Coordinator at ISSUP, and I'll be your moderator for this online event. Our distinguished speaker for today is Giovanna Campello, who is the Chief of the Prevention, Treatment, and Rehabilitation Section of the United Nations Office on Drugs and Crime, UNODC. Giovanna is here today to discuss the key highlights from the 2023 edition of the UNODC World Drug Report. Now, this report in question is a remarkable piece of work. It comprehensively highlights the growing complexity of evolving drug threats. Now, this not only offers us a global perspective, an overview of the world drug problem, but also offers some impartial evidence that will encourage dialogue and shared responses, as we hope to achieve with the webinar and our follow-up Q&A. I don't know if you've had a chance to look at the World Drug Report yet, but the presentation was taken a notch higher with the online segment that has simplified the user experience and enhanced access to the truckload of information captured in the report. Now, before we get started, I'd like to go over a few things to ensure your participation in today's event is smooth and seamless. Firstly, we have made provision for Spanish and French interpretation. Now, this is available through the entire session. You can access it by reading, look at the chat window. You realize that the information is there and the link is there. So whether you want the Spanish interpretation or the French interpretation, you would find the information in the chat window. You can also submit questions live to our presenter by typing them into the questions pane of the webinar interface. These questions will be collected and we'll address them at the end of the session where we have our Q&A session. A recording of the webinar will also be made available to you to watch on demand after the event, and a certificate of participation will be emailed to you 24 hours after the webinar. So now a little bit about our honorable speaker. Giovanna Campello has more than 25 years of experience with the UNODC in supporting member states and stakeholders at all levels in improving their drug prevention responses, whilst also contributing to scientific evidence. Notably in that context, Giovanna has led the publication of International Standards of Drug Use Prevention in 2013 and the UNODC WHO's second updated edition in 2018. Since 2016, Giovanna has been leading the UNODC Prevention, Treatment and Rehabilitation Section, thus promoting evidence-based gender and human rights sensitive practice on drug prevention, treatment, care and rehabilitation, as well as working on the critical issue of access to controlled medicines. Giovanna, thanks again for joining us, and over to you.
Thank you, Radolf, and thanks to Joanna and all of the colleagues at ISSUP and all of the people joining from all over the world for joining and giving me the opportunity to continue this tradition that has started last year, but all traditions need to start somewhere, right? And that gives me a really, really great opportunity to look in depth about the work of my colleagues at the Research and Analysis branch in analyzing huge amount of data and creating the World Drug Report every year. And I would really like to acknowledge the fact that I am here presenting to you because we are all part of the same network, but I'm really standing on their shoulder, on their hard work in presenting this data to you that I hope will very much inform and support our joint work in promoting evidence-based prevention, treatment, and care. So having said that, let me first of all see what's the time so that I don't go over that much and show my screen, and hopefully you can soon see the slides. Now I need to somehow, you can probably see the slides. I cannot see them myself, so it's a bit, you will need to be a bit patient with me when I hide this. Okay, by now, I hope you can see the slides, and I know that you will tell me if you don't, and I can start. I have divided this presentation in 3 big segments. The first one you can see here on the screen is general developments, where I give you the broad information and the broad main points that are coming from the analysis of the World Drug Report this year. In the second part, there is some very interesting points with regard to development substance by substance, which I thought might be of interest to you. And then in the last part, I will present some of the points that are coming from what I call deep dives. So our colleagues in the research and analysis branch have taken certain issues with regard to the world drug problem and looked in depth about certain issues and do like a little monograph. And I will present some main points out of those little monographs, let's call them like that. But first of all, general developments. And these are the figures that we quote and we use day after day. And here you have the new figures with regard to how many people use drugs. So this is past year use, so 296 million people. And how many people use with drug use disorders there are in the world? 39.5 million people. Now you can see here 23% increase in the number of people who use drugs and 45% increase in the number of people with drug use disorders. And these are very important new data. One thing that you need to keep in mind, though, is that these are absolute numbers, okay? So if you look at this number in percentage, you will see that the percentage has increased, but not as much as it would look like here, because the population of the world itself has increased. So as you can see here, it mentions how increase in the number of people who use drugs is partly due to population growth. So it's maybe not as dramatic as these percentages show, but there is an increase. And as in the past, the cannabis is still the most prevalent drugs. And then we will see later how it's still opioid that cause the majority of the burden of disease attributed to drug use. The other thing that we want to notice here is the gap in provision of treatment, with only one person with drug use disorder in treatment with people with drug use disorder who are in treatment. Only one person with drug use disorder in 5 is in treatment. So I don't know about you, but when I saw this figure, I thought, wait a second, this is actually great news, right? If you remember my presentation from last year, or figures that have been quoted in the past, it used to be 1 in 8 or 1 in 7. And I'm thinking, wow, now it's 1 in 5. It is still bad. But if you think that we have moved from 1 in 8, 7 to 1 in 5, in the context of a higher number of people with drug use disorder, this is actually not bad news. So I went very excited to my colleagues in the research and analysis branches. So this is great news. And then they had to say, Giovanna, hold on a second, hold on your enthusiasm. In reality, it's 1 in 5 because there has been a change in the methodology with which we have done the estimates. So we cannot, I underline, compare with the figures in the past. And this is a better estimate of how many people with drug use disorders are actually in treatment, which is, as it used to be, unfortunately, a difficult situation, with only about 20% of people who need treatment actually in treatment. So this was the excitement with regard to the prevalence. And in this slide, we have here on the left a similar representation of the data on people, and the number of people who use drugs, the number of people with drug use disorder that I presented in the previous slide. But here you have the data on women who use drugs. And as you can see, still women, much less women than men use opiates and cocaine, very low. A bit higher, the number they use cannabis and ecstasy type substances. But when you start looking at amphetamines and non-medical use of pharmaceutical opioids, and all of these are synthetic drugs, by the way, you can see much more similar levels of drug use than men. And what I really like about how the colleagues have started to do this kind of analysis is that instead of having a special chapter on women, you will see how in many issues there will be always an analysis of men and women mainstream throughout the report, which I think it's really good. This is our, I think, overview of the world drug problem in broad strokes, and in fact, almost literally, because you can see these broad strokes of color that represent the different kinds of use. And if we go quickly through this, I think that it provides a very nice summary, starting with North America, which is, of course, unfortunately, everybody knows, dominated by high level of opioid-related overdoses, but also cocaine use and an increasing use of methamphetamine. And moving down to Latin America, we can see issues around the manufacture of methamphetamines and opioids in Mexico, cocaine trafficking, cocaine production and trafficking as we move down, and also cocaine use disorders. So really a continent dominated also by cocaine use. Moving on to Europe, we have an expanding cocaine market. This we will see also later. Increasing use of amphetamine type stimulants that adds to the opiate use. In Africa, we see the non-medical use of tramadol and increasing in cocaine trafficking. But if you look at Eastern Africa, there is heroin use that is spilling over from the trafficking, from the transit. Sorry, I don't find my cursor anymore. And high prevalence of HIV among people who inject drugs, which you also find around Southern Africa, accompanied by use of synthetic stimulants and with an issue around heroin and cocaine trafficking. Moving to the Middle East, we see a lot of trafficking and use of captagon and amphetamine type stimulants. In Eastern Europe, Central Asia, we have opiates production, trafficking and use, increasing methamphetamine trafficking and use. And of course, this is unfortunately linked to high prevalence of HIV among people who inject drugs, which is also an issue because of the levels of opiates use in the area here around Russia, with an expansion of new psychoactive substances and synthetic drug markets. Moving more to further parts in Asia, there is a high prevalence of opioid use, but an expanding amphetamine type stimulants market here in the South Asia region, and in East Asia, there is methamphetamine manufacture and opiates production, which is then accompanied by large methamphetamine market in eastern part of Asia, with the addition of cocaine if we move more down to Australia. And I think that this is an excellent summary. There are some new trends. A lot of it is known already, but I think this gives us a good overview of the challenges that we are all collectively facing. Now, if we look a bit more in depth about the global burden, of use. Of course, one particular, we need to devote particular time to injecting drug use that is particularly linked to the burden of disease, because the majority of drug deaths attributed to drug use are due to liver disease attributed to hepatitis C. And that is very much linked, of course, to injecting. And there are 13.2 million people who inject drugs. This is an 80% increase over last year, but I understand that some of this increase in the number of injecting, in the percentage of people who inject, is also due to a new methodology in the calculation of the number of people who inject drugs. And of these people, 1 in 8, or 1.6 million people injecting drug live also with HIV. And here you can see what I was mentioning to you before in terms of analysis. So we have very clear indication that men are 5 times more likely to inject drugs, but women who inject drugs are 1.2 times more likely to be living with HIV/AIDS. And so again, here, some food for thought for all of us to address what is at the moment the highest burden of disease. The other burden of disease is, of course, linked to overdose, which for some reason is not here. It will come up later. But here I have a nice slide on the barriers to treatment and how they remain. We already saw the 1 in 5 data, but also they remain for women as well. Women continue to be underrepresented in drug treatment. So, for example, only 1 in, what is this? This is only 27% of people who with amphetamine type stimulants disorder is in treatment, but we had seen that the percentage of people using amphetamines that are women was much higher before. So this is something that persists, and we know we have good tools to address this barrier. We need to do more to use them. In terms of treatment demand, we have cannabis and opioids as the 2 main drugs reported among people in treatment. But of course, and this is to be expected, methamphetamine predominates treatment demand in Asia and Oceania. And we will see later how the report also includes an analysis of what happened on the COVID pandemic and how this has worsened the treatment gap. Another important group that we need to keep in mind is young people. This is for 2 reasons. First of all, in some countries, a significant majority of people of the population is young. On the other hand, we know that there are young people are more vulnerable to drug use and drug use disorder, and we know that the earlier young people and children start to use, the more likely they are to develop mental health disorders later in life, including drug use disorders, of course. And here we can see how in all regions, young people, which are in red, are as the prevalence of use among young people is at least as high, if not higher, 1, 2, 3, 4, than in the general population. And in some countries, a very significant percentage of people in treatment is under 25 years of age. Now, the other thing that we need to think about is that young people is a broad category. And this includes, for example, adolescents who use drugs or with drug use disorders, for which the treatment gap is higher than for other people with drug use disorders, and because the available options for treatment are more limited. So, and this of course has implication to maybe really invest also not only in treatment for this target group, but also on prevention to avoid as many people as possible needing treatment. Finally, in terms of broad stroke and moving away from use and treatment, a very important issue, the other side of the drug control system, which has been created to protect the health of people from dependence, of course, and other harms associated with drug use, but also to ensure that the medicines, the control medicines that are needed in medical practice are actually available to patients. And this, of course, includes opioids for the management of pain. And the picture that you see here is not substantially different from what has been reported ever since INCB, WHO, and UNODC have started to look at this issue in depth for the last 10, 15 years. It's very clear that there is a huge inequality between access in high-income countries and in low- and middle-income countries, and in low- and middle-income countries, there is basically very limited to no access to control medicines, particularly for the management of pain. And you see in this slide a tiny increase, improvement, because in high-income countries you have a slight lowering of access, which is not necessarily a bad thing, given that in some countries we have had cases of overprescriptions, and this has led to problems. And you can see here tiny minuscule increase of accessibility in low and middle income countries, but is far from enough. And I'm hoping that we manage to all join forces as WHO, ISSUP, national government, civil society to address this situation as well. Okay, so this was the broad strokes. I hope you're still with me. I cannot see you, so it's very, very difficult for me to understand whether you are all asleep or have left to have a coffee. I hope you're still with me, and to go through the substances, some information substance by substance. So, for example, this is cocaine. Let me see the screen properly. And cocaine really has been showing signs of rising supply and demand worldwide. In figure 16, which is actually this one, you can see how the cultivation of coca bush and the cocaine production have reached record highs in the last 10 years, and it really has been rising strikingly. Also, the population of cocaine users has been steadily growing due to global growth and also, of course, prevalence rate. And we have good indications of cocaine markets in Africa, Asia, and Southeastern Europe experiencing a rapid growth. So here in figure 15, you can see some indicators with regard to consumption. This is the box, it is this green line, the seizure, and these are the boxes, and the red, the purity of cocaine in Western and Central Europe. And you can see how all indicators are showing an increase. And these are data with regard to use in the United States specifically. But I think that the data on Western Central Europe are really striking in showing increase across indicators. With regard to methamphetamine use, also we see that the use is high in Southeast Asia, but it is expanding in other regions as well. So if you see here in figure 2021. East and Southeast Asia with North America really dominate the market. It's really all of this. But non-traditional markets are also rising, and this you can see here and here. There have been new clandestine labs of methamphetamines production reported in Southwest Asia, South Asia, Africa, and Afghanistan is also emerging as a major producer. And we see indication of trafficking routes extending to Oceania, Europe, and other regions. And so it's really an expanding market that we need to keep an eye on, particularly in countries where that were used to a more traditional opioid or opiates kind of market, and where the treatment and prevention is geared to address that, but it's changing. The use of opioids continues. This is what you can see in this slide, and how it is, of course, dominated by use in Asia. More than half of people who use opioids are in Asia. You can see here that there is an issue, a serious issue in West Central and North Africa, which is very much driven by the non-medical use of tramadol. Tramadol is not a controlled substance, it's not a controlled opioid. And of course, we all know about the opioid crisis in North America, which is driven by fentanyl and fentanyl analogs, with fentanyl found in 86% of opioid overdose cases in Canada. And this is a more in-depth look at the impact of opioids, with over 80,000 opioid overdose deaths in the US in 2021, and mostly due to fentanyl. And here you can see instead in countries of, these are countries of Africa, of West Africa, pardon, with high numbers of people seeking treatment for tramadol use disorders in various regions. And here you have the data for West Africa. But the colleagues have also looked to other kind of substances. So here you have data about ketamine. Let me check if there is something also. Yes, also the next slide is about ketamine. Ketamine is not a controlled substance. It's a substance that is used as anesthesia in veterinary practice, so medicines for animals. And but it has been used non-medically in recreational context in East and Southeast Asia. And we have seen signs of traffickers promoting ketamine through mixtures with other unknown ingredients targeting the illicit market. And it could become a mainstream drug in some population groups. Now, here on this slide, you can see how the East and Southeast Asia really dominates the places where ketamine and this kind of substances have been seized worldwide by sub-regions. And but here you have use of ketamine, and you can see indication of the use of ketamine globally. And so on, this is of concern because chronic use is associated with somatic and cognitive harms. And we have seen ketamine manufacture and trafficking expanded to Western Europe, Middle East, South Asia, North Africa, and Oceania. Thinking about all of the synthetic drugs as a whole, this is a very interesting analysis the colleagues have done, and I invite you to look it up in the booklet. Basically, what they have done is they have looked at the supply chain of plant-based drugs. You see them here on the left, and synthetic drugs, and of course, and compare them. So, unlike plant-based drugs, synthetic drugs require only cheap chemical input and can be easily sourced. You don't need a field, you don't need cultivators, you don't need a plant to survive, right? So synthetic drugs have no fixed geography and shorter production site times. And by now, laboratories have been detected, I will not read them, all over the world. And you can see how the supply chain of synthetic drugs here compared to the one of plant-based drugs is actually, I guess that in business terms, we would call it an agile kind of supply chain that is much more quickly adaptable to restrictions in the markets and flexible in terms of geography. And this also, I think, has been reflected in the fact that after a pause, possibly due to COVID, but there were signs a bit before. But now, recently, this year, you can see this little step going up. There has been an increase in the number of new psychoactive substances on the market for the first time after a while, particularly cannabinoids and synthetic opioids. And in some regions, it's not only the number of substances that has increased, but there are indications of significant use in Central Asia and Eastern Europe and some other regions. So this is, of course, of great concern because new psychoactive substances are by definition new and little is known about their harms to health and there being dangers in terms of fatalities, particularly and toxicity. Although, you know, we also need to always keep in mind we can do a lot to address them. We should not just put our hands up in despair and say they are new, we don't know what to do. You can do a lot by going on symptoms, and we have developed tools to this effect in the past. So again, something to be concerned about, something that we can do something about, and that we should. Finally, how much have I left? I believe some 10 minutes. I have some interesting deep dives that I was mentioning to you. And the first one, Radolf already mentioned. It's a real new innovative feature of the World Drug Report by which a lot of the data that I have presented to you is now available online and is customizable. So first, for example, now this is a bit small, but let's say here you can read very small global cocaine news. Let's say you're interested in that, right? You click there, and then this will produce a graph, and then with main messages on what the graph shows. But then, for example, let's say that you are interested only in the Americas. Then you could click and filter the data of the graph so that the graph shows you only the data from Americas, for example, and then you could see what the situation is there in specific. So I think this is an amazing, and there are, I don't know, I think it's more than 90 kind of indicators on use, on seizures, on production, on trafficking that you can choose and customize and look in depth about what data is there. So this is not that something that I can present in depth, but I invite you all to Google the World Drug Report, and this will get to the page where you can immediately see the online segment and play around with this data to your heart content and be able to use it and inform your practice. So I thought that was a wonderful, wonderful new feature that the colleagues have introduced. But they have also looked at all of these new issues on drugs. Some of them I've already presented, for example, on synthetic drugs. but some others I haven't, and so I have a few slides for you on this. The first one is that they did is to look at the different frameworks for the medical use of controlled drugs and specifically herbal cannabis. And they have done a huge work to systematically represent the huge variation in this kind of regulatory frameworks, from the very solid to the less solid, which happens against the backdrop where here the efficacy of cannabis use for the treatment of health conditions still remains moderate, insufficient, or inconclusive. So very, very difficult balance to achieve there. And I invite you to look more into the specific of all of the countries that have provisions in the national legislation or in policy, in whatever way, allowing the medical use of cannabinoids, pharmaceutical preparation, or cannabis-based products for medical conditions. And the other thing that they have looked at is in terms of development of frameworks for the medical use of controlled drugs is to look at psychedelics. Because as you know, there is a very strong interest in the use of psychedelics in psychotherapy, so in the treatment of mental health disorders. And as you might know, the research on this is still very tentative, although there are some indication of potential benefit, and there are a couple of very big trials that are ongoing right now, and that would provide good answers as to whether things like LSD or psilocybin, I'm sure I mispronouncing it, are actually effective, well, at least efficacious in the treatment of mental health disorders. But at the same time, the development is that some of these substances are used in things that range from actual traditional and indigenous rituals to the cultural appropriation of such rituals for tourism or self-medication and or experiences of spirituality, mindfulness in the context of a well-being and touristic industry that does not, because it's not part of the health industry, let's say, is not regulated at all. And it will be a huge challenge to prioritize public health in the face of growing commercial interest in developing and profiting from new legal drug markets, similar to what has been happening with cannabis. And of course, at the same time, there is this perception of these substances as relatively safe, in fact, as leading to spiritual and mindful experiences that could further encourage unsupervised non-medical use, for which there are potential harms. So this is one very interesting issue that is addressed by our World Drug Report. Another issue is with regard to a very vulnerable population, which is the more than 100 million people displaced by humanitarian emergencies in 2022, for example, and the majority of which are in low and middle income countries, and do face an elevated level of vulnerability to substance use disorders in a context where availability and accessibility of mental health services, including drug use disorder services, remain a challenge. And the chapter is very interesting. It tries to summarize the evidence that there is on the levels of substance use and substance use disorders in humanitarian settings. As you might know from our work in this field, which we have fed into this chapter, the picture is not very clear. And in some instances, you see lower rates of substance use and substance use disorder than the host population. In some instances, you see higher rates. In some instances, you see displaced people that bring with them their pattern of use. And in some places, you see a displaced population that pick up the pattern of use in the host population, depending on the availability of the substances. All of this, though, is very much has in common the elevated level of vulnerability and the lack of services. And I think you all know that we are all striving together to address such situation. We have developed effective tools to address the vulnerabilities, particularly to families such as strong families. And we are working with WHO and UNHCR to develop effective tools to address substance use disorders in the context of mental health and psychosocial intervention in humanitarian settings effectively. So that was a humanitarian setting. Another chapter of which I will not mention so much because it's really not my area of expertise, but I think it might be of enormous interest to some of you or to all of us, is a chapter on how illicit drug economies converge with crimes and conflict, and specifically how the illicit drug economy accelerates other illegal markets that harm the environment and human rights. And the chapter does a fascinating analysis specifically of the Amazon basin, as you can see in these two pictures, looking at how drug cultivation, trafficking, environmental and related crimes rise together and are connected to each other. And they are associated to, of course, the abundance of natural resources, but also corruption, inequality, and high levels of unemployment. And I invite you all to read this fascinating chapter that is really describes very complex issues that would be difficult to summarize very quickly. And finally, I mentioned in passing in one of the first slides how treatment, access to treatment had been impacted by COVID. And now, I don't know about you, but for many of us, COVID almost feels like far, far away. But you know, its effects are still with us, and our colleagues in the research and analysis branch have done a very good job to keep on tracking what is happening and what has happened as a follow-up to the pandemic, where they saw a decline in drug treatment during the pandemic, but they also kept on tracking a decline in drug treatment also after the pandemic. The other thing that they have noted, and you can see in this nice slide, is that the pandemic brought to the fore innovations in drug services, particularly telemedicines and take-home dosages that ensured a minimum of continuity of access for certain population groups during the pandemic and could be used to improve access, particularly in rural areas, right? For other population groups also now that we are out of the pandemic. The important thing is that we do follow up with good monitoring and evaluation, because of course it's one thing to resort to telemedicine and take home dosages during a crisis situation like the pandemic, and we have seen some good evaluation showing that the take home dosages did not increase harm, did not increase diversion, and so on. But we do want to be sure that we are providing effective treatment to the population who need it, and we don't just resort to the cheapest and easiest way just because we want to improve access. So there are promising results of continuity we need to study. And I think that was the last slide. Let me check. Yes. So here, let me close. Thanking you again, and especially all those of you that have managed to listen through all of this huge and an enormous amount of information, which I thought, though, again, I would like to acknowledge the work of my colleagues. I think you will agree with me that is the result of an enormous work, outstanding in its richness, and giving us further understanding that could and should guide us our collective efforts to improve the health and well-being of people worldwide. So let me give it back to you, Radolf. Maybe I hope I've done okay with time. I think I was okay, and there is still time for question and answer.
Yeah, we have time for a few questions. Thank you very much. So we'll zoom in straight to the questions.
Okay.
Okay, I think our first question was very good. Okay, I must mention that Giovanna, you've had a lot of compliments in the chat window. A very good presentation.
Okay, don't we skip. I'm blushing a bit, and I thank everybody. But let's keep go to the questions.
The first question was, I didn't see any data on alcohol use disorders. Does it mean its usage has decreased?
Super question. I wanted to mention it. So the World Drug Report does not report on alcohol, and that's why you didn't see the data, because I was presenting you the highlights from the World Drug Report. But last week, I had the opportunity to be at the forum on alcohol, drugs, and addictive behaviors organized by WHO. Joanna was also there. And now, unfortunately, I don't remember off the top of my head the data on use. But I know that, first of all, the data on life use, let's say, past year or lifetime, disorders, and that's attributable to alcohol, is significantly higher than those attributable to drugs. And the colleagues had done a really interesting analysis, because you might remember that harmful use of drugs is one of the indicators under Sustainable Development Goal Target 3.5. And so the member states have committed themselves to lower the prevalence of harmful use of drugs. And there was an initial analysis presented, which is not published yet, so I cannot give you the data, but the thing of the researcher was that the member states are not on track. That while there was some small decrease in some indicators, overall, that was not the case. So what I can tell you is, no, it has not decreased, and B is much higher than the indicators on drugs. And I invite you to, as I said, unfortunately, I have the data, but it's not like a cut and paste, and because we promised that we would keep confidential until they're published. But I invite you to keep an eye on the website of the team on alcohol, drugs, and addictive behaviors on the WHO, because they will publish this soon. And very interesting indeed. Very good question. Thank you.
Thank you. Next question was an inquiry into the situation in the Caribbean regarding opioids, amphetamines, and synthetic drugs.
Oh, that is too difficult. I only looked at the broad strokes, and I think that the best would be for a participant to go and play around with the online data that I showed, because there is bound to be a place where, you know, he or she would be able to zero in into the data from the Caribbean look more in depth about what is available. The booklets are also available and would give a narrative. But beyond what I have presented, I cannot be more specific. I'm really sorry. Next year, I promise I will present a better analysis by sub-region.
Okay. We also have, you talked about there being barriers to treatment, which we have some tools to address. Could you direct us where to look for help with overcoming some of these barriers?
I believe I was talking about women, right? Women who use drugs, women with drug use disorder, and their barriers to treatment. So I will put in the chat once I finish our publication page. The most important documents there are three. One is the standard on treatment, because the standard of treatment, although it's general, has a specific section on supporting women with drug use disorder. Second, there are the guidelines that have been published by WHO on the management of substance use disorders in pregnant women, which are specific group and very, very important, because, of course, addressing the disorder in a good way through voluntary and evidence-based treatment, and I stress voluntary, this is an opportunity for everybody, for the health of the mother-to-be, but also the one of the child. And last, we have some guidelines that we have also published in 2016 on prevention and treatment for girls and women that might be of interest. Then, of course, I know that ISSUP, and here, Radolf, you will come in, and maybe Joanna or Olivia can put the things in the chat, has a specific curricula for the training of service providers that serve women who use drugs and women with drug use disorder. I believe GROW is the name, and that is a very, very important resource. And I will, my partners will forgive me if I'm forgetting some other key tool, but this is what we're here for. If anybody knows a good tool, please put it also in the chat, so that we all benefit from each other's knowledge.
Thank you. I think we have another question here, which is, do we know why there's so much higher a percentage of young people in treatment in South America? That is 54%, and Europe being 12%.
Yes, I saw. No, we don't know. I really don't know. I mean, I think part of the answer is, of course, the profile of the population at large, right? So the population is much younger in Latin America than it is in Europe in general. But I was also struck by the fact that 52% of people in treatment seems to be young in Latin America than in other places. But I wouldn't take it as a bad sign. I think it's a good thing, because in reality, in all countries, we have seen how young people are the majority of people who use drugs, and therefore to have a treatment system that is capable of serving the population as it is a good thing. But I cannot say beyond what I mentioned. It's more speculation than anything.
Okay. Also, do we have any data or analysis on availability or numbers and types of prevention services across nations? Similarly, numbers and types of treatment services.
Whoever asked this question has my heart forever, because I have been going on and on for a long time to the effect that the numbers for treatment are terrible, but at least we have numbers, and for prevention, we don't. And at the time when the Sustainable Development Goals have been agreed by the member states, 3.5 is about strengthening prevention and treatment. And I had fought hard to have a prevention, coverage of prevention as an indicator, but the consensus was, and I have to admit it is true, it's not easy to calculate coverage of prevention, because by its nature, prevention is multi-setting, multi-age, multi-level of risks, and it becomes very difficult to calculate how these people, how everybody should be covered at which level, right? So I'm giving a long answer. The short answer is no, we don't have that kind of thing. And I just presented in the forum of WHO exactly to this effect. And a couple of people came to me and said, like, we could try to do this and that. And I said, I've already tried and it did not work. But let us keep on thinking together, because I think that the fact that there is no coverage really harms the field. The fact that we cannot say, look, we are covering only 1% of the people that we should be covering, opens up the field to the accusation of the field not being effective. But if we cannot cover, how can we be effective? But we are not able to say that beyond anecdotic information. And please, anybody who has an idea, let us keep on working together to be able to do for prevention on what has been done for treatment as well.
Thank you. So I think time is fast spent, and we'll have to wrap up our Q&A session now. Giovanna,
okay.
Thank you.
Other questions that we did not manage to address, I can also try to address them in by email or something if needed. I mean, you'd let me know.
Okay, so I think we'll compile any other questions that would come up, and then we can just send them via email.
And maybe we can publish something on the ISSUP website, just to direct people, especially if they're looking for resources and stuff.
Okay, I think, yeah, that would be a great idea. Yeah. But Giovanna, thanks again. It was an informative and interesting discussion as always. It's always a real pleasure to have you online with us. So this brings us to the end of the webinar. And as a reminder, you will receive a follow-up email within 24 to 48 hours with your certificate of participation and a link to view a recording of today's webinar. And if you've not already done so, please head over to the website, issup.net, where you'll find lots more of information on our work and how to become a member. Don't forget to like and subscribe if you're watching the recording. On behalf of ISSUP and our presenter, thank you for joining us today, and have and enjoy the rest of your day.
Thank you so much.